to Ellevate Louisiana Engage podcast. Ellevate Louisiana was founded earlier this year to empower women leaders throughout Louisiana by connecting and educating them on the challenges impacting our state with data-driven, nonpartisan solutions to make a better future for Louisiana. Hello, I'm your host, Julie Stokes. Today, we are recording the second episode in a series on the state of healthcare in Louisiana. Our guest today is Karen Stubbs. She is an assistant secretary in the Louisiana Department of Health. She's in charge of the Office of Behavioral Health in Louisiana. Karen joined the Department of Health in 2013, and as head of the State of Office of Behavioral Health, she leads policy decisions addressing prevention and treatment of mental illnesses, substance abuse disorders, and addictive disorders. Karen previously held the position of Deputy Assistant Secretary for the Office of Behavioral Health in the Health Plan Management Division. Karen's career spans leadership roles in the Office of Juvenile Justice and as the Executive Director of the Children's Cabinet in the Governor's Office. Karen is an attorney who graduated from the LSU School of Law in 2003, following completion of her finance degree from Tulane in 2000. Throughout her career, Karen has been responsible for healthcare policy, compliance administration, legal, and legislative activities. Welcome, Karen.
Thank you for having me. I'm very happy to be here.
Well, we're very excited to get to talk to you because mental health in general is one of the most important issues that I think we deal with as a country, as a state. And we know that this year in particular has been hard on a lot of people, and there's been a whole lot of goings on. So this seemed like a really important topic for us to get to. And just to kind of bring everybody up to speed, and we talk about how healthcare in general was privatized in Louisiana in 2012 or 11 or something like that. And that when that happened, it culminated in the privatizing of the charity hospital system, and instead forming a system of Medicaid service organizations to ensure the people of Louisiana through Medicaid. And then Medicaid would be used to pay for their care at privately held hospitals that used to be government held hospitals. And so my question is, what did that look like for mental health? Because I know that that happened at the same time. And I guess what I'm trying to get at is, what was the mental health care system like before privatization, and what is it like now?
So thank you, Julie. So in 2012, Medicaid moved to a Medicaid managed care environment. So there were companies that came in to manage Medicaid participants' health benefits. In 2012, right before 2012, in the behavioral health arena, so behavioral health meaning mental health and substance use disorder treatment, that only looked like mental health. Substance use disorder treatment was not covered under Medicaid and had not been for some time. So in the move in 2012 to the Medicaid managed care companies, they expanded the number of mental health services that were covered under Medicaid, as well as added those substance use disorder services that existed really only if you had private pay or uninsured. And so it vastly expanded when we moved to managed care, the number of services covered under Medicaid, which was great. It also allowed kind of more of those individual licensed mental health practitioners to start to participate in the Medicaid arena. And so before, when you had maybe only large hospitals, so institutional type care, or your regional series of human service districts and authorities, or LGEs, which are unbelievable partners and behavioral health providers, that's really where you focused your services. But when we moved and expanded the services available in Medicaid in 2012, those kind of private providers, maybe your more mom and pop or your more specialized providers, were able to take advantage of serving Medicaid participants. And so you still have the provider types that you saw before the Medicaid move towards expanding the number of services in the behavioral health world, but now you also have more.
Well, that's good to hear. Because I think people worry about that it, made less available, but it sounds like it actually made more available and in a format that was more accessible to people.
I agree. I think it really allowed, behavioral health tentacles to really get out into the community. There are still places that definitely don't have as many behavioral health services as they should, but it allowed the in reach to kind of expand.
Well, and along those same lines, I think one of the things that I learned when I got into the legislature, and I really didn't know prior to that, was, about how people of Louisiana can access the mental health care system. And, that changed. And I think there's three categories. There's people that have regular insurance, people on Medicaid, and then the uninsured. Can you tell me a little bit about how those three groups access their mental health care?
Absolutely. So, access to services is the biggest question I get. And we can have all the services in the world. We've got thousands of providers in our Medicaid system. But if you don't know how to access them, what's the point, right? And so, we get asked a lot. Our office gets contacted. How do I find a provider? How do I get services? How do I know what services I need? And I basically ask this question: do you have insurance? Do you have your private insurance or commercial insurance? If so, you call them and try to find a provider or go on their website, just like you were looking for a dermatologist or another type of provider. Do you have Medicaid? You contact your insurance company, the Medicaid plan that you have, with the phone number on the back of the card. If you don't know what Medicaid plan you have and you have access to the internet, we can look that up, or you can look it up. If you don't have access to the internet, you can call the Medicaid office and they can help you look it up. And then you proceed through your Medicaid plan, just like someone with a commercial insurance plan would. They can provide you with names and resources of providers, or you can scroll through their list online on their website or the Medicaid website. And then if you don't have insurance, we still have this amazing group around the state of regional human service districts or authorities. Some people call them LGEs, local governing entities, but these are community-based, regionally based, and they're driven by the needs in their community. So there's a cultural competency there because it's much more organic to what the community needs and the services they provide. But they are really a nice catch-all. Regardless of your insurance or uninsured status, they can provide behavioral health services.
Yeah, and that's so important. I remember many years ago, probably 10 years ago now, I helped a girl who had just found herself in a bad situation, and she had been left by her husband, and she had three kids. She didn't have a car, she didn't have a computer, and it was so hard on her. And it took us a while to get her set up with benefits, but that's when we found the Jefferson Parish Human Services Authority, and how important those resources are. And that's one thing I want to get across to people, that is there, and every community has their own. And some of them that are more rural in nature, they're probably a little bit further drive, but they're there for you, to help you through the tough times. So
They are a great resource and almost kind of a one-stop shop for your mental health and substance use treatment needs. A lot of them are getting into primary care now as well. They might have an FQHC, a federally qualified health center, to get your kind of physical health needs met at the same time. They're really doing some creative things. And these are just large-scale providers in your region that are great. If you don't know your insurance, you don't know the provider you want, they're a great option.
absolutely. So I guess, I'd like to just hear a little bit about you and your background and your past experiences and how they influenced your leadership style and your vision for the Department of, Behavioral Health.
Well, thank you. I mean, my background and professional experience has been a unique one for the behavioral health industry. I rarely advertise that I'm actually an attorney, kind of in a behavioral health setting. But I started my career as right out of law school as a criminal prosecutor in a DA's office. Ended up running a juvenile division, which really linked me closely with the Department of Child and Family Services and Office of Juvenile Justice. I did a lot of with DCFS, the child welfare system, their child in need of care proceedings, and then moved on to work on the state policy level with corrections and juvenile justice population before coming to behavioral health. But the common denominator there in my career path was really working around and with and for vulnerable populations. And as the behavioral health arena moved into Medicaid, and Medicaid's just kind of a regulatory beast. It's a monster, and it's really complicated because it is so regulatory. That really attracted me to coming here to the Department of Health. And so I feel like my leadership style really reflects the empathy that we have for the populations we serve. It's about serving, it's about helping those who need assistance, and it's about empowering people and giving them a voice. And so I try to kind of reflect that in how we run our office here at OBH Central Office. And, I love a robust discussion. I love different perspectives. Because of my, very first kind of grown-up job, I really appreciate healthy conflict and expect everyone to have an opinion. And I don't want it to be the same as mine. And I tell people, my first 5 years in my job, I went to work every day in a courtroom and had someone whose sole job was to prove me wrong. In my public defender. And then we went to lunch every single day. And so, I really come from a place of let's disagree and let me hear you. And I might not agree and I might overrule you, but I need to hear it. And we have a lot of fun with that.
Okay, so if you're ever not working for the state, you need to join Ellevate Louisiana, because that is what we are. And when you said that, that you were attracted to it because of the complexity of the Medicaid system, I thought, everybody on this planet runs. That's not usually an attractive force, but good for you, because somebody.
When I got to OBH, I asked if they would purchase a code of federal regulations for me, and it was like Christmas when I got the green book. And no one in the Office of Behavioral Health had ever heard that. I was just so excited to dig my hands into regulation. So.
Yeah, that is a gift, and we're very grateful that you have the tenacity to do that and the willingness to explore different points of view, because I think that's one of the great gifts that people can give this world, especially right now. And speaking of right now, it's been a crazy year. I couldn't have called this in a million years that we were going to have a public health crisis like this and be socially distancing and wearing masks. I mean, we actually went to China last summer, so 2019. And when everybody was wearing masks, I thought, this is so weird, and here we are right here in the United States, everybody wearing masks. It's crazy. But, between COVID and then we had, one really bad storm that hit the southwestern part of our state and really tracked all the way up the state. So it did some damage all over the place. And with kids isolated in virtual settings doing school and losing their after school programs, some of them. And I just think about the mental health landscape of Louisiana has to be in pretty dire need, I would think. So, are there any kind of new supports or just supports that are available now because of this new reality, and how is it going?
Absolutely. I mean, no one's untouched right now. No one's mental health is untouched in the state or in the country. And I think the unfortunate positive is that mental health and behavioral health services has finally gotten the attention it deserves and kind of risen in the importance level when you talk about healthcare. We are regularly mentioned in governor's press conferences and on the news and talking about mental health. And I think it's important that the conversation has kind of highlighted this, but there's a distinction between mental health and mental illness. And mental health right now is everyone's concern. It used to be there was a lot of stigma, there was a lot of taboo. You didn't talk about mental illness, but we're talking about mental health and kind of stress and anxiety as part of our like normal vocabulary now from the behavioral health world, who's been silently screaming, this is important and it needs to be at the table in every discussion, in every disaster, in every plan. People are finally starting to buy into it. And so we knew in March when this happened, when my team and I just work with the most amazing clinicians, and we heard social distancing, and we thought, oh my goodness, we know where this is going to lead to with the isolation and the stress and anxiety. And we weighed our own kind of private campaign, private because it didn't catch on at first, with physical distancing, because more than ever you need to stay socially connected. And so what we did in March, within a week of the stay-at-home order, was open a hotline. And originally we called it Keeping Calm Through COVID. We have since changed it to just Keeping Calm for two reasons. First, I said all the kids abbreviate everything, so we should shorten it to stay relevant. But also, once we started getting the weather events, the only stressor was not COVID. It was a common theme, but all of a sudden, emergency response, as we're used to, also became another stressor. And so we have things like our Keeping Calm hotline. It's 24 hours a day, 7 days a week. It's a toll-free number, and it has trained professionals to sit and talk to you. So it's on the phone, it's confidential and anonymous, and the people answering the phone do a couple of things. They might just be a listening ear. You might just talk about your day and how that Zoom fiasco was so frustrating and stressful. Or you might talk about your specific feelings. I can't stop crying. I'm very agitated. I can't sleep at night. And they could walk through some stress management techniques. They can listen to you and talk to you, give you some advice, help you cope in crisis, hopefully do some crisis prevention tips. And I have several people that I know on a personal level who've called, and they said as soon as the person answered, their just blood pressure kind of, just settled, just knowing they were going to be able to talk to someone. And we've received well over 6,000 calls. I think as of Thursday or Friday, 6,444 calls. And it is statewide, and we just encourage you to use it. And I'll ask you to publicize the number, and we've got a flyer, but just so you know, the number is 1-866-310-7977. We then, as the crisis kind of went on, we saw the need from the behavioral health perspective. So those struggling with mental illness or addiction, or those in recovery from either of those, need kind of a special resource. So we opened up another hotline, same MO, 24/7. It's toll free, it's confidential, but geared towards those in recovery who might be starting to feel a little unstable, or starting to think about turning back to substance use, or just question their recovery. And so that is a specific recovery warm line, and that number is 833-333-1132. And then there's also a texting line. There is a segment of our population who's just more comfortable texting. So we have a crisis text line that's also available 24/7. The text line is 833-TXT-TEEN, TEEN. And so those are the free resources available to everyone. Really on a first level, maybe I don't have a mental illness, I don't have a diagnosis, I don't want to go in and see a provider, I just need to talk to someone now to keep it from building and resulting in more treatment.
Yeah, that's so good. And so when we're wrapping up, part of my wrap up is going to be to let you re-announce those numbers, just in case anybody missed that. And so one thing I wanted to clarify too, like let's say that you're 16 years old and the world's really very difficult right now and you need to reach out. Can a 16-year-old, can somebody under the age of 18 call that number?
They sure can. And in fact, the text line, originally we were calling it the teen text line, but it's not just teenagers. So absolutely, it's anonymous. And we would encourage you, we also have our suicide prevention hotline number, and there's a teen component to that if that is the specific situation.
Yeah, and I'd had here to ask you about some of the ways that OBH, or Office of Behavioral Health, was expanding services and how to access them. And I wanted to make sure before we moved on that, is there something else there, or is that what you wanted to share with us?
Well, there are a couple of other things. So we immediately went into how can people maintain connectivity to their current behavioral health provider. And so I just want to encourage people that telehealth. And so a lot of people hear that and what is it? And why wasn't I able to use it before? And telehealth just means, in our world, behavioral health, that providers now, for the majority of services, are allowed to communicate with you over the phone. So in the hotline number that I just gave, maybe that's a situation where you don't have a current behavioral health provider. You're not in active treatment. Maybe you never have been, or maybe you haven't in a while, so you don't have that provider connection. But if you do and you're in treatment, the providers now, both substance use and mental health within Medicaid, are able to provide those same services through telehealth, so on the phone. So please reach out, see if they're, if they have adopted that practice. We've seen a significant increase in telehealth utilization within Medicaid. It's really been great. Even with our early childhood services, we have a group of services that are specifically geared towards early childhood and behavioral health. And 90% of those providers immediately flip the switch and were able to go to telehealth to allow those families and young children to kind of not miss a beat.
That's really fabulous. And I mean, I can't even say enough about how you can go to a doctor in the amount of time that it takes to have the appointment. There's no more waiting in waiting rooms. Even though you might wait in one, you can still be on your computer answering emails or whatever while you wait. I mean, so it's, I think, a really big improvement. And I think, if nothing else good, but I think there will be other things comes of all of this, it's that sort of access will be, available in greater or more wide availability.
Yeah, it's interesting because we have our licensed mental health professionals were allowed to utilize telehealth with Medicaid prior to COVID, and very few took advantage of it for multiple reasons. And really, I mean, in person is probably best, but it's a great kind of plan B or backup or additional tool to have in your tool chest. And then when COVID hit in March, I mean, all of a sudden you see that utilization just expand, and we see it still hanging on. I mean, people are still using that even though a lot of offices are open. And so I don't see it going away. It's kind of here to stay as an additional tool.
Yeah, and it does bring up the same recurring theme that we've had in so many of these videocast podcasts, is this broadband issue. When you get into some of the rural areas of Louisiana and some areas that you wouldn't even expect, there's broadband access issues, and that would, stand in the way of your access to care, except that you could call your 800 numbers and,
And I will
but
say something we did to address that, and it's likely temporary during COVID, but prior, telehealth used to require, as per federal guidelines, an audio and visual component, which kind of lends itself more towards like the iPhone or a computer. But they waived that requirement to allow, or if you don't have it, you can use just a telephone, which could imply that if you have a landline now, you can use that. But again, that federal audio video combination really, especially if you don't have broadband, it really hinders and really just kind of compounds, the disparities that we see across the state. But right now in Medicaid, that shouldn't be a problem.
well, that's great to hear. That's really good to know. So, how would you explain to the public some of the ways that the Office of Behavioral Health is aligning with its vision, mission, and guiding principles?
So, our vision I love, because we talk about people can and do recover from mental illness and addictive disorders. We also talk about clinically effective behavioral health treatment and supports and positive outcomes. And so we are really focusing on our evidence-based practices. That's that clinically effective behavioral health. And evidence-based mean it's been rigorously studied, usually in academics, but not necessarily with proven outcomes. And we are specifically focusing on trauma-informed practice. I mean, between COVID and the stay at home and kids not in school, and cut off with, on a Friday basically, and on Monday they were at home for months and months, and the financial stressors and social injustice situations that we have going on, and the weather events, Laura and Delta, and other evacuations for storms that weren't as large. Trauma is we're really going to see that emerge, and PTSD. And so we have partnered at the beginning of the year. Well, we have a partnership with LSU Health Science Center to look at training in certain evidence-based practices. And so at the beginning of the year, we turned towards a lot of these trauma-based practices. And so really trying to look ahead at what will the public need and how can we start addressing that and getting a larger provider pool trained up in these trauma-informed evidence-based practices, specifically geared towards children and families.
Yeah, it's really so much my hope that we don't have another big wave of it in the later fall and winter months. It really concerns me because I watch my own kids, who have a very healthy environment in good schools and everything. But social life is so impeded by all of this that it's like I remember my own days at those ages and think this is so different, But they were kind of used to the virtual world anyway, I guess. But I
Yeah,
guess
you're right. As a parent, and I do want to, I'll promote on our website, the Office of Behavioral Health's website. We have a whole section for parents and families that talks about talking to your kids and coping through, not just we have some that are general to disasters, because in Louisiana that can't be far away, but also specific to COVID and the effects of isolation.
so. I would like to ask at this point, Ellevate Louisiana has been formed to try to advocate and help areas of our government that we think might need some help in public awareness and, advocating. We've got a strong group of women, and we're looking for the things that we want to advocate for. When we, entered into this talking to you about Office of Behavioral Health, we thought, what can we do to help, and what do you need? Like, what could a group like Ellevate do to help you advance your mission, and what do you need right now to reach and help more people?
We need messaging. We need awareness. We've got, just for example, within Medicaid, thousands and thousands of behavioral health providers, but they do no good if people aren't aware that they're there or that's a treatment option. We've got treatment options for the uninsured, and then even for those of us with private insurance, commercial insurance, we need to have the discussion so people feel comfortable reaching out. It's one of the reasons we did the anonymous hotlines, because some people are just not comfortable asking for help. So we need you to help advertise the resources we have. And then secondly, we need this group as women, as professionals, to be comfortable opening the conversation and asking people how they're doing, sharing resources, sitting and listening. I mean, that's what women are good at. We've got that listening ear, and I'm not, there are definitely men that are good at it too, but, allowing a safe space for the conversation to happen and people talk about it. And maybe you don't know what the answer is, but then saying, I think you should talk to someone, or here's a resource. Those are our two main ask of you.
Well, thanks. And that'll be easy, and when you guys share things on social media, we'll make sure to pick them up. And if there's something that you want to make sure that we see, let us know and we'll make sure to get them out. Because honestly, I would think that some people that have private insurance don't even realize that times have changed over the last 20 years, really. I mean, I think it's about over the last 20 years. You could correct me if you think that it's different, but insurance didn't cover a lot of behavioral health or mental health services. And now I think there's a much greater, availability of that people might not even be aware of. And
Yeah.
life is hard. I mean, life is hard. And we're in a culture where you put on your happy face and you keep going. But it's okay that life is hard sometimes.
I agree. There was always this attitude, especially around behavioral health, and you saw it a lot with substance use. Pick yourself up by your bootstraps. And just carry on. The rest of us are doing it, and I found, and maybe it's because I'm immersed in this really compassionate substance use community, where that has that's no longer, there's this acknowledgement of there's an addiction that's bigger than you and you need help. But on the mental health side, the mental illness side, it's still, they still have the same mentality, like just snap out of it. Like, it's hard for all of us. But I haven't yet seen the embrace of acknowledging until really recently that you can't just snap out of it. You might need help. You might need talking. It's not a linear recovery either. It's kind of, it's all over the place. It's ups and downs, and it's recovery and then back. And the only thing that helps it is communication, and then encouragement of getting help from professionals if needed.
Absolutely. Well, we're about out of time for today, but before I wrap up, I would like for you to repeat those numbers for those people that are listening via the podcast, and we'll put them on the screen for those that are watching the video. But if you could repeat them, that would be great.
Absolutely. So the Keep Calm line is 1-866-310-7977. The behavioral health recovery line for those individuals in recovery, although they'll take a call from anyone, is 1-833-333-1132. And then the text line is 833-TXT-TEEN. So TXT like text teen.
Awesome. Well, I would just like to thank you for the work that you do, for the tolerance for details and regulation that you have, for the unique background that you bring to this office. Thank you so much. And thank you for being here today with us.
Thank you. And thank you for highlighting mental health and addictive disorder needs. Appreciate it.
Awesome. So for those of you who are listening, if you're interested in joining Ellevate Louisiana, visit our website at ellevatela.org. That's Ellevate with two L's, ELLEVATE, LA.org. You may also listen to all of Ellevate's Engage Fit interviews on platforms where you find your podcasts. And finally, don't forget to like Ellevate Louisiana on all social media platforms, and share this videocast on your page if you found it interesting. I'm your host, Julie Stokes, and we'll see you next time.